The first sign of a stroke, taking action immediately is vital. Dr. Mahesh Jayaraman is the president-elect of the Society of Neurointerventionalists, and he is here to discuss the signs of stroke. Good morning.
Good morning, Angie. How are you?
I'm very good, and this is such an important topic for all of us. So just kind of walk us through what people would notice if they are having a stroke.
So we use the acronym BFAST to try and teach the public about the signs and symptoms of a stroke. The B stands for balance, sudden loss of balance. The E stands for your eyes. If you notice a sudden visual disturbance, especially a blind spot in one eye or both, or things such as double vision. The F is for facial droop. So if you notice one side of your corner of your face, your lip is drooping. The A stands for arms. If you notice that your arm is drifting down and you're not able to keep your arm up. S is for speech, and that can either mean that the words are slurred when they come out, or they're not making sense, or that the person's not able to understand what's being spoken to them. If you notice any of those things, the T stands for time, because it's time to call 911. So that's be fast. And remember to call 911 if you see any of those symptoms. It doesn't have to be all of them. It can be any of them.
So that acronym has changed just a little bit. So what was the story behind adding to the acronym?
Sure, that's a great question. So we had used, for many years, we'd used the FAST acronym, but there are strokes that can involve the blood vessels to the back part of the brain. And those can be harder to pick up, and they can affect things like the balance and like your vision. And that was the reason for adding in the B and the E, was to remind people that strokes can also affect things like balance and vision. So that's why we've gone from FAST to be fast.
Well, and speaking of fast, why is it so vital to get treatment at the first sign of a stroke?
That's a really great question. So, 2 million neurons die every minute that they don't have enough blood flow. But it's hard to put that into perspective. But I'll give you a different statistic. So for every minute that there's a delay to treatment for a patient with a stroke caused by a blockage of a major blood vessel, a patient loses about a week of independent life. So think about that. Every minute delay costs the patient a week of life where they're alive and able to care for themselves.
That is very sobering to think about. So how do you treat this? What are the procedures that can help a person return to their normal life?
So certainly we hope people identify and call 911. When you're taken to the hospital, there are a variety of treatments available for patients who have blockages in the blood vessels. There are clot-busting medicines, and they work well. But for the big strokes caused by blockages of the major vessels, the clot-busting medicines are not enough. And there we do a procedure called a thrombectomy, where we go into the artery in the wrist or the leg in a minimally invasive fashion and very quickly are able to go up to the blockage in the brain and grab that clot and pull it out and restore the blood flow.
That is very encouraging news. Can you send our viewers to a website to learn more?
Sure. To learn more, go to getaheadofstroke.org and learn about how you can help yourself or loved ones survive and thrive after a stroke.
Thank you so much for this life-saving information. Thanks for being with us.
Thank you. Have a great day.
And you too. We'll be back with more local lifestyles right after this.